Hi, my name is Leanne May, and this is my long-term care presentation after having read Dr. William Thomas's book, A Life Worth Living. I'll be making reference to his book, as well as Scott B. Ray's Introducing Christian Ethics, Gordon T. Smith's Courage and Calling, the Revised and Expanded Edition, and John Pratt's text on long-term care. Something that both Pratt and Thomas point out is the inappropriate adaptation of the acute care modality to long-term care. They cite that it's inappropriate because the objectives of acute and long-term care are very different. Acute care, your patient comes in, they get treated, they go home, usually in stable or better condition than they arrived. Long-term care, the patient arrives and typically stays there for the remainder of their life in a perpetual state of decline. And although there might be some improvement here and there in their state, that ultimately these people are progressing towards death, not towards better health. And that is something that Dr. Thomas argues about, the difference between care and treatment, and that we're not looking to treat these patients as much as we are looking to care for them. That's not to state that their physical health is of unimportance. It is of importance, but of equal importance, if not more so, is their sense of wholeness. And so in creating the Eden alternative, Dr. Thomas attempts to improve upon the quality of long-term care by helping redress a sense of purpose, worth, value, and dignity to combat the loneliness, helplessness, and boredom that people in long-term care so often suffer from, and that ultimately the impact it has on their health is rather negative. And that's not to say that Dr. Thomas's patients or those who receive Eden Alternative long-term care get better and go home, but their quality of life is vastly improved over the historical dependency of long-term care models. So to address the first question in the prompt, which was, what did I think of Thomas's recommendations? Would I have made better recommendations? I don't have any better recommendations than Dr. Thomas set forth. I think he did an extremely adept job at succinctly articulating and as well as comprehensively articulating the issues with long-term care and narrowing it down to a really good root cause, and then making very practical suggestions that I think even Arthur, a previous text on lean healthcare Six Sigma, would state as implementing practical, easy changes as soon as possible, and not making those changes too complex because it makes it easier to implement and sustain them. Thomas kind of blew my mind with the things he suggested. He expanded upon what I consider to be a heart issue in long-term care, and that's the lack of love shown to these people, most often because society deems them as not having any worth or very little worth because they're unable to care for themselves, let alone others, or to be productive members of society. And that kind of tails into the second question about my biblical beliefs and how they underpin my view of long-term care and any suggestions I might make. And that is something that Scott B. Ray talks about, which Thomas echoes but doesn't specifically cite as a biblical reference, and that's that we are all created in the image of God. We all have inherent, inestimable worth, and that does not wax or wane with what we are or not doing in our lives or our level of productivity. Again, Dr. Thomas doesn't actually state, I'm a Christian, I do this because I'm a Christian, but he echoes the imperatives that the Bible sets forth about the value of human life, something that Scott also talks about in his book, and that because of that value, just because somebody transitions, as Gordon Smith would talk about, from one life stage to another, from retirement to long-term care, or from independence to dependence, that the call on your life by God is not diminished. If anything, it evolves and it changes. And that goes back to the Bible talking about the importance and the relevance of our elderly and what we can learn from them and how they impact our lives. And Thomas really talks a lot about that in his chapter about children, introducing children into the setting. And we've moved too far away from having this community involvement with elderly, younger, and everybody in between, and the importance, the vitality that creates for both groups, both the elderly and the young, and any other group setting for that matter, how that feeds us how that's vitally necessary to our ability to flourish as a species. And, you know, Thomas does kind of go on to talk about the liabilities of bringing in children, let alone plants, cats, birds, starting a garden, all of the different suggestions he makes. There's all liabilities to them. But what I really, really liked, he pointed out what I think rather bluntly in chapter 17, and he says, risk is a part of life that cannot be totally eliminated, and that all of the suggestions that he's made, despite the risk, are well worth it because of the good that they do. I think we get so hung up on regulations, which are not necessarily a bad thing. We need those regulations to protect people. But we get so hung up on checking boxes and engaging in the treatment modality that we neglect the soul of the people that we're caring for. And Thomas's entire idea with the Eden alternative is to dispense with treatment, really, and to engage in care, to create a sense of wholeness and a sense of purpose in individuals that have suffered a very big loss in their life. And it's our job as administrators to really imbue their sense of purpose back into them once more by showing them that they are still of value, not because society places that value on them, but because God does. So thank you.